That's another aspect. For example, in New York resolution concerning non-communicable disease in September, I get a call from Professor Kurokawa before going to New York, because we have received a draft resolution in September meeting. So the term of kidney is not included in the resolution. So Professor Kurokawa recommended me to put the term of kidney in that resolution. That is a very difficult task, because it's already done as a draft, of course, in New York. So we have maneuvered such kind of activity in order to insert the term of kidney in the resolution. We have faced a big objection to include kidney. As a consequence, to make a long story too short, as a consequence, we can't insert the kidney, but we could insert renal diseases. So I called Professor Kurokawa, we have done. So the outcome was very successful. For example, one third of renal failure, for example, dialysis, renal dialysis, one third of new patients are coming from diabetes. So it is very important. It's a paramount aspect in terms of diabetes and both renal failure. So this is the case, and also this is a very complicated way. So as a government in Japan, so we have 120 million population. Out of 120 million population, we approximately 27 million people are 65 years and older. Over 65 years people are already 27 million people in Japan. So this is a kind of a heavy burden for government in terms of course, medical expenditure. So it's a big work to be solved as a non-communicable disease. Maybe I should stop here.
水谷さん、どうもありがとうございました。日本が政府としてグローバルなヘルスの課題に対応していくにはなかなか難しい政治の問題があるということと、先ほどからありますように NCD というのは非常に複雑で難しい問題ですので、政府としても対応がすぐできるという問題ではないということをおっしゃっていただきました。では続きまして、ブレナン様の方から、ブレナン様もですね、この9月の国連のミーティングの方にご出席されて、そこで製薬団体の代表として、製薬会社の代表としてご講演をされました。ブレナン様にもそこでのハイレベルミーティングで感じられた印象、それから製薬業界としてこの NCD に対して何をこれまでやってきたのかという、この2点についてお伺いしたいと思います。
Okay, thank you. Great, well, thank you very much. Good afternoon to all of you. As you heard from the introduction, I am currently the president of the IFPMA, which is the reason that I attended the meeting in New York. I'm also the chief executive of AstraZeneca, which is a rather large pharmaceutical company. I think bringing together the IFPMA, which is our global trade organization, and my company perspective allowed me to participate in the high-level meeting in a very meaningful way. And I think the healthcare industry generally welcomes the United Nations and the World Health Organization initiatives in this area of non-communicable diseases. When I attended the summit in September on behalf of the pharmaceutical sector, I think it was a key milestone, and I think it was a very clear example of how we can and how we must harness the capabilities of the private sector as well as of NGOs and of governments to tackle non-communicable diseases. For our part, at a pharmaceutical industry level, we're adopting a collaborative approach, one that I think is needed to meet the challenge and to find a way for us as an industry sector to be part of the solution. As has been said a few times here this afternoon, I think NCDs are a global problem and a real challenge everywhere. The problem is now disproportionately affecting people in developing countries. The comment was made earlier on one of the slides today that NCDs cause roughly 36 million deaths annually, and some 80 to 90% of those are actually suffered in low and middle income countries. So this is a significant burden on the countries that were brought to bear on that. Advanced economies like Japan, I think, face challenges that range from lifestyle choices to aging populations, and again require what I think was described earlier as a multi-sectoral approach to promote better public health. And I think the smoking example that was given is a great one. I think that the spirit of collaboration to bring all these bodies together really begins with the healthcare sector. I think the approach has to be holistic. I think it needs to include prevention. I think it needs to encompass a full range of interventions, which is what we talked about in New York. And those range from early detection and diagnosis through to access, which is a very, very important element, affordable health care, and adherence to programs to ensure that patients understand the importance of the commitment that they're making to trying to deal with the diseases and with the treatment programs that have been prescribed for them. Now, you asked about the industry. As an industry, I think we've tried to do a lot excuse me, to address the NCD challenge. We've made significant investments in research and development in developing treatments for non-communicable diseases, which are widely used. Roughly 85% of my company's R&D resource goes into the areas of non-communicable diseases as described by the definition. As an industry, we've established over 200 partnership programs which address a wide variety of healthcare constraints in developing countries. We've invested in strengthening healthcare systems, in improving health education, and in capacity building. So there are a number of initiatives that have been undertaken on the part of the industry as well as by my own company. What are we doing? I think it was a broad approach that we adopted. In June this year, the IFPMA launched a 10-point framework for NCDs that primarily revolve around the key themes of innovation, of prevention, of capacity building, and of access to healthcare as well as to medicines. Obviously, as a research-based industry, we have a strong commitment to research. We commissioned a report to try to help us as an industry understand what we might be able to do. That first report was published in September. I think it demonstrated that there are a number of obstacles that are barriers to access, and gave us some principles for what needed to be done to overcome those barriers. I think, you know, my summary of the research is that the reality in the developing world is that many patients just don't receive the treatments that they need, and that we know we have a role to play in trying to overcome those obstacles. So we're doing some additional research, but certainly infrastructure building is important. So for us, I think the work represents both a framework for action as well as a framework for dialogue. The New York meeting, as was said a few times this afternoon, was just a start, but I think it was an encouraging one, and that was the feeling I left the meeting with. I think as an industry, we have a significant role to play in overcoming some of those obstacles that were identified both by the research we did as well as what was discussed in New York. The scale of the problem mandates that governments, industry, and civil society come together to find what I would describe as effective and practical solutions. We are busy consulting extensively with external stakeholders to try to understand better from an external perspective what people believe our approach should be. I think there are opportunities in collective approaches to NCDs in advanced economies such as Japan, which we discussed earlier, where early detection, prevention, and diagnosis can lead to improved health outcomes, which is really what we are focused on. And I think that, in Japan there are, there's been progress in extending longevity rates, which primarily depend on the prevention of major risk factors. Tobacco smoking, the use of tobacco came up, but high blood pressure, several cardiovascular risks are examples. And despite the decline in the prevalence of high blood pressure in Japan in the past 4 decades, it's actually still not satisfactorily managed here in the country. It's estimated that about 1/5 of the population is effectively controlled with hypertension. So I think the roundtable here is a good opportunity to share with each other what we're already doing and explore areas for greater collaboration, because I think if we're going to tackle NCDs, we have to do it with the mindset that we want to improve the lives of patients and their families, and that we want to bring together a benefit to wider society from the work that we do. So I think I'll stop there and say thank you.
皆様どうもありがとうございました。NCD に関しては政府、製薬業界、そしてシビルソサイエティと多くのセクターの人が一緒に取り組まなければいけないということ、そして全体的なアプローチが必要であるということ、その中で製薬業界の果たす役割は非常に大きく、例えばR&D においてはその 80% 以上が NCD 対策、NCD の薬の開発に使われているという話もいただきました。最後、日本への期待もおっしゃっていただいて、まだまだ日本の国内でもこの NCD に対しての対策が不十分であるという点はあるけれども、早期の発見、そういったテクノロジーやシステムにおいては非常に学ぶべき点があるという話もいただきました。で、最後の言葉はやはりこの場のようにですね、たくさんのセクターの方が集まってこの問題を話す場というのは非常に大切だというコメントもいただきました。どうもありがとうございます。それでは続きまして、ペース様ですね、ダンス・アームストロング財団のディレクターをやっていらっしゃいます。ペース様の方に、質問をさせていただきます。これまでダンス・アームストロング財団の方で主にがんの患者の方と一緒にアドボカシーを行っていらしたという実績をお持ちです。非常にシビルソサイエティとしてがんの分野での実績を残されている、財団でありその方で活躍されてきた方なんですけれども、その経験というのを簡単に皆様の方に、私たちの方に教えていただきたいのと、その経験を踏まえて NCD 対策、がんも含まれますけれども NCD 対策についてのご意見をお伺いできればと思います。
Great. Well, first of all, I'll say good morning to everyone, and I'll say good morning because it's about 5 a.m. In the U.S., so I apologize if I seem a bit groggy, but I'll do my best. I would like to thank the Institute, actually, for inviting Livestrong to participate in this panel. And, of course, Livestrong, or the Lance Armstrong Foundation, is thrilled to be here talking about civil society because civil society defines who we are. And so I guess to describe how we approach the high-level meeting and how we approach our global work in general, we had 3 objectives in advance of the meeting in New York. The first objective was to highlight the survivor or patient in everything that we did and to be sure that other stakeholders were highlighting the survivor and the patient. And that's largely driven by our mission. So we were founded by somewhat of a celebrity cancer survivor, but we feel as though we represent the 28 million people who have been affected by cancer worldwide.